pandemic has added a whole new layer of patients into the healthcare system. To deal with the crush inside our hospitals, doctors say we need system-level solutions. Inside this building in London, Ontario, is a model for speeding up general surgeries, and we're going to show you how it works.
Can I get a 2-0 also? Proline, please.
This surgery will change Mary Curry's life. She's had foot pain for months. It's physically limiting and psychologically exhausting, but her pain is not life-threatening.
Can you hold me a small wire or two?
If not for Abdel-Rahman Lawendy, this procedure probably would have been pushed down a growing list of non-urgent surgeries. The average wait time in Canada last year was about 25 weeks. Curry waited roughly 14 for this moment.
You're going to be able to walk on your heel today within a special shoe.
It feels like you're inside a hospital, but it's not. This is an ambulatory surgical center. Ambulatory means the ability to walk. All patients, like Curry, who have surgery here, go home the same day.
A little groggy, but pretty good.
While there are similar clinics in Canada, London's ambulatory surgical centre is part of the public healthcare system. It's backed by evidence and a well-known donor. There are 2 operating rooms here, and staff perform between 10 and 15 surgeries a day, mostly orthopedic, but also some hernias, and they perform them at least 30% faster than in the hospital. This is a standard OR room
So
here?
this is a standard operating room. It's a standard.
Dr. Lawendy is an orthopedic surgeon. In 2016, he started looking for ways to make the city's large hospital operating rooms more efficient.
I kind of mapped out or modeled the OR in terms of its inputs, throughputs, and outputs, and thought, how can we essentially make this quicker, cheaper, faster, and better for patients?
Large hospital operating rooms must be prepped and ready for anything, whether it's a simple knee replacement or complex cancer surgery. It's all done in a critical care zone, which requires about 6 medical staff per operating room, and every surgery starts with a full range of sterilized medical tools just in case.
Surgery is very steeped in culture. Things are done a certain way because they're done a certain way. So if you were to model the operating room as a block, like this.
Preliminary findings from his research suggest things can be done differently. In a trial involving 1,000 patients, surgery care costs in the conventional or large hospital operating rooms ran about $469 per patient. In the high-efficiency or ambulatory center, it was $172. The cost difference in labor and materials is roughly 60%, as less complex surgeries often require fewer staff, less time, and smaller medical toolkits.
By cutting all of that stuff out, you essentially can drive the cost down significantly and then increase the efficiency, which in our system doesn't necessarily translate to saving more money. It translates to treating more patients.
Research suggests patients treated in regulated ambulatory centers also have fewer post-surgery complications. Sounds like a win-win, but shifting culture is never easy.
It was a bit frightening at first.
Gillian Holborough manages the operating rooms at the ambulatory surgical center and the larger ones in the nearby London hospital. She's seen firsthand how streamlining surgeries made the hospital more efficient.
Being able to take smaller procedures out of these big operating rooms just allows us to be able to do more surgery.
And patients like Anne Maddock reap the benefits.
You know, you hear the horror stories of patients waiting months and months for simple procedures. So this is just incredible.
So lucky to have it so close to the main hospital.
She's waited about 3 months for her foot surgery. Within the hour, it'll be done. The Ontario government is looking at this public system model as a way to safely speed up surgeries. Based on the evidence, Dr. Lawendy and many other docs hope this will be the future of care for Canadians.
I do think it's scalable, but I guess the will has to be to scale it.
London Health Sciences has plans to scale up this ambulatory surgical center from 2 to 6 operating rooms, so more patients can have their surgery, go home, and get on with their lives.
Take care. Thank you.
Christine Birak, CBC News, London, Ontario.